Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Shifa Holistic Healthcare Center in Nigeria, Kaduna, Nigeria. My name is Walid Shauki Mukarim. I am the head therapist and the head trainer here at Shifa Holistic Healthcare Center in Kaduna. Welcome to this talk that we're having in preparation for our diploma class in Hijama therapy and traditional medical science, NSQ levels 1 and 2. Inshallah, I'll be going through some points regarding this diploma for enlightenment and to add knowledge and information to those who would want to go through this program. We are always open to questions, and inshallah, we'll give answers as best as we can. This program in itself is divided into 3 parts. One part is for Hijama, one part is for traditional medical science, and the third part is for both Hijama and traditional medical science. Inshallah, I'll take you through what we have prepared and what will be taught. So welcome once again to Shifa Holistic Healthcare, Nigeria. This is a talk regarding our diploma in Hijama cupping therapy and traditional medical science, NSQ levels 1 and 2. Now, this course, who is it for? Who do we target and who is open to come in to learn? Practically everybody is welcome. As long as you are somebody who seeks knowledge, who wants to improve yourself, improve your skills, improve your professionality in what you're doing, and to get an added skill. It is for those who want to learn a Sunnah way of treating ailments as a skill or as a profession, or as a skill and a profession. It is open for doctors, physiotherapists, nurses, acupuncturists, traditional medicine practitioners, and holistic healthcare professionals. These are people who would find the use of Hijama very useful in treating ailments that are not very treatable using allopathic medicine. It is also useful for therapists who want to gain more confidence or learn how to add Hijama to their treatments. You find there are a number of people who would fall into this category too. Different requirements for gaining insurance in various countries demand that you have a professional certificate that is recognized by government and accredited by relevant accrediting bodies that would accredit you and pronounce you fit and licensable for that practice, which is what we're trying to achieve here. For those who want to treat friends, family as a healing practice and Sunnah, if you have a therapist who knows how to do Hijama at home, it goes a very long way. It is a skill and a profession that is very easy to master and build on. Those who go into massage, whether traditional massage or other types of massage, would find this course very useful. And those, like I said, who want certification that is recognized and employable by government and private sectors or private institutions, this course is something that you should consider going into with all your heart and delve into it. Now, I have mentioned NSQ a few times already. NSQ is National Skills Qualification. It is an international program that a number of countries have keyed into, including Nigeria. What is gotten here is it is a skills qualification framework which works with your prior knowledge. This particular program that we're running with NSQ levels 1 and 2 is to get you certified as a traditional medicine practitioner 2. The Nigerian Skill Qualification Framework is a system for the development, classification, and recognition of skills, knowledge, understanding, and competencies acquired by individuals, recognizing and taking into account prior learning, knowledge, and experience. So it is a scalable assessment that assesses you on your knowledge, what you know and your experience in the field that you need to be assessed on, and it satisfies you with a nationally accepted qualification. This assessment is graded from level 1 to 9 here in Nigeria, and it's like from a certificate level up to PhD. You can be graded and awarded such a certification, and defined in terms of learning outcomes, which each learner must possess, regardless of whether they were acquired through formal, non-formal, or informal learning. Like I said earlier, it is prior learning your skills. So this program is also for traditional medicine practitioners, as I've said, other professionals who are in the medical field, and those who just want to learn. This certification would go a very long way. It is employable. It is accepted by the Ministry of Establishment here in Nigeria. So you can actually go places with this certificate, and it is a nationally acceptable certificate too. It is a nationally integrated education and competency-based skill and quality assurance framework that will provide for multiple pathways linking one level of learning to another higher level. This will enable a person to acquire desired competency levels and transit to the job market. So for those who want certification for work that is acceptable, here at Shifa Holistic Healthcare, we give you a certificate after our programs that is IPHM accredited and certified. IPHM is the International Practitioners for Holistic Medicine. It's an organization based in the UK, and their certificates are accepted worldwide. And we prepare you to be able to get your NSQ certification. If your country where you're learning from accepts or has the NSQ framework, you can key in to it. So traditional medicine or medical science in itself, in traditional medicine, we treat holistically. Every part of the body is looked at when we want to give wellness. Here, disease is seen as a result of an imbalance in the body's natural existing temperament. As we go further, you will understand the temperament of the body and how it goes. And once there's a change in that temperament, it is considered as sickness. Whether this change is in the systems of the body or the organs or the tissue, cellular level, mental, emotional, or spiritual level in the body, it is classified as sickness. So we would go deep into this as we go into the program, and you become one of our students, inshallah. What would you be learning when you come to Shifa Holistic Healthcare? You would be learning how to communicate, what type of communication takes place within the traditional medicine workspace, teamwork as a health practitioner in your place of practice, health and safety in your workplace, You get to understand basic concepts of anatomy in traditional medicine, how our ancestors looked at the body and why traditional medicine works on a temperamental base and not on other bases. You find out all traditional medicines work based on body temperament, whether it's African traditional, whether it's Ayurvedic, whether it's traditional Chinese medicine, whether it's Islamic medicine, Arabian medicine, all of it, the same thing. You'll get to understand the basic concepts of physiology in traditional medicine. You learn how to diagnose and treat in traditional medicine, identification and collection of medicinal plants, how to dry these plants and store them in by use of traditional medicine methods, which is different from, you will get to understand why things are done the way they are, why in the village your grandmother or the health person there stores certain herbs in cloth or in clay pots or in horns. What is the science behind it? It is all logical and there's a science to it. Anas ibn Malik reported that Nabi Sallallahu Alaihi Wasallam said that indeed the best of remedies you have is in cupping. Cupping is Hijama therapy. We'll go into the history of it as we go. And here we see Abu Huraira also reported that Nabi Sallallahu Alaihi Wasallam said if there was something excellent to be used as a remedy, then it is in cupping, Hijama. So you would learn what Hijama is, its history. Is there a difference between cupping therapy and Hijama therapy, and what makes that difference? You would know and get to understand the theory, the science behind it, from the traditional medicine perspectives of those who practice it. And Hijama has been around from time beginning, we could say. Nobody would ever tell you when it started, where it started from, but we have recorded history from the Chinese that dates back over 3,500 years. In the Arabian Peninsula, we have some that date over 2,000 plus years. So it's been around for a very long time. And it's still working and it's time tested. You would see what modern science now is telling us about Hijama's benefits and why a lot of sports people and people are really going into Hijama. Introduction to organs and systems of the body. You'll be getting an introduction to functions of blood and lymphatic fluids and what they do in the body. You'll learn counseling and patient management in traditional medicine, basic preparations of medicinal plants, administration of these medicinal materials, nutrition and disease prevention. From the traditional medicine perspective, you'll find out that it is very rich and it has been there from beginning of time. It is what was used and is still being used. And you find World Health going back to traditional and herbal medicine. We'll talk about how to formulate and package your medicines from the traditional medicine perspective of packaging and formulation, how to cultivate these plants and conserve them for further planting and use. And there will be introduction to Hijama points, the theory behind it, and why those cups are put in there, the contraindications of wet cupping and dry cupping and go. We would go through introduction to herbal medicine preparations, traditional and Islamic, patient consultation and diagnosis, introduction to understanding test results, because your patients would come in with various test results probably before they come to you. They've been around trying to find a solution and they find out that the best thing to do is just to come to you. Introduction and understanding to those results would come in at the basic level, how to keep records of your treatment, how to perform Hijama, clinical best practice, aftercare for Hijama, and what Hijama is used to treat. So you find there's a lot to learn. There's a lot to learn. Coping ailments and health concerns, hygiene, health, safety considerations for Hijama, traditional paradigms for best results for Hijama, equipment lists, safe disposal and other considerations of materials used, best business practice, how to run your business properly, and holistic Hijama treatment protocols that cover body, mind, and soul, practical class demonstrations. For those in Nigeria who would come to the training center, you would have hands-on practical classes. And for those who would be learning online, you would just get demonstrative classes, and you would run your one-on-one class where we monitor what you're doing, how you're doing it. Now we would go through a number of treatments through the program, the course of the program. So when we come to treatments, we'll be looking at headaches, what brings them, types of headaches, and what they tell you about the ailment that causes them, because in many cases, headaches are seen as a signal. Blood pressure, asthma, stomach ulcers, arthritis, back pain, knee pain. We'll talk about memory problems, from dementia to Alzheimer's to a few of them. We're not go into very much details here at this level. Maybe in our advanced diploma class, we'll go further in. We're looking at some ailments that are very common: erectile dysfunction, fertility issues, diabetes, cancer, digestive issues, muscular issues, and some other ailments we might look at and decide to talk of them through the course of the program as the class goes, and from questions and things that will come up through class. So for those who are going to be doing a hands-on here in Nigeria, they would be given a kit, a Hijama set, a kit for the practicals they'll be doing with us, which would include a 24-cup Hijama suction set, a pack of disposable hand gloves, pack of lancet needles, cotton wool, bottle of olive oil, and methylated spirit. This will all come in a pack that you can carry around with you. The idea is when you finish your program, as you walk out the door, you should be able to start treating people. Like I said, this course will be divided into 3 selectable parts. One, you could do a diploma in Hijama cupping therapy for 6 months, which will have online theory and demonstration classes, online one-on-one practical, supervised practical training, while those who would be here, who would come to the clinic for training, would have the same as the class that is online, but would have clinical hands-on practical Hijama training with it given to them. Now, you could opt for the diploma in traditional medical science, which will run for 6 months too. The same thing, online theory and demonstration classes, supervised practical classes for plants and preparation, while those who are doing the course here in class with us would have hands-on practicals for plants and preparations, because they would see the plants, feel them, taste them, and things like that. But that's a choice one would make, or you could take both of them, which will now run for 9 months, a diploma in Hijama cupping therapy and traditional medical science. It will run for 9 months, and you will have both of what you will have on the other 2 here running for 9 months. You can contact us here. Yes, these are our contacts here at Shifa Holistic Healthcare. We have our website, which you can visit, and our email address is here too. You also have our Facebook link You have numbers you can reach us on. We are open to questions, and inshallah, we hope to start in March for this program. We look forward to you coming in and joining us for this program that has a lot of benefits to you personally and to the society in general. Should you have any questions, please do not hesitate to call, mail, chat us up on WhatsApp, and we will be very ready to fill in. Forms will soon be available for the program, hopefully in the first week of February. We should have all the forms out for those who are interested. But please feel free to ask any questions you have regarding this. Thank you very much for listening. Thank you very much for attending. Have a lovely day. Have a lovely evening. Assalamu alaikum.